Hello, I'm Dr. Harold Koenig. I'm excited to be able to talk to you today for 20 minutes on faithful practice of spiritually integrated mental health care in secular contexts. First of all, I'll talk a little bit, give you a little bit more information about myself. Then I'm going to answer the question, is bringing up spirituality or religion ethical in therapy? Next, we'll talk a little bit about the guidelines of the American Psychiatric Association, the Royal Society of Psychiatrists, and the World Psychiatric Association with regard to addressing spirituality in clinical practice. I'll talk about the mental health spiritual history and then review some Islamic-based religious psychotherapies and then provide you with some further resources. I will also briefly look at the research in this area, so to review that. So first of all, I'm a physician. I'm a professor of medicine and psychiatry at Duke University. My specific area of expertise is as a research scientist studying the relationship between religion, mental health, and medicine. And I've been doing this for about 35 years. I've written and published over 500 scientific peer-review academic papers and have over 50 books on this subject. And if you look at the PowerPoint presentation, or the website is up there, the link to the website. I'm a Christian, a conservative Christian, but in many respects, I'm also a Muslim. I've worked with many Muslim investigators in Iran and Saudi Arabia. I just returned from Saudi Arabia, studying the relationship between Islamic beliefs and practices and a person's mental and physical health across a wide range of physical illnesses. I seek every day to submit my life to the one and only God. And this is my motivation for everything that I do and say. Just a slight word on the relationship between Islam and Christianity. The Holy Quran says that Christians are closer to Muslims than any other religion that exists on the face of the earth. This is from the Quran, chapter 5, verses 82 to 85. You, prophet, are sure to find the closest in affection towards the believers are those who say, we are Christians, for there are among them people devoted to learning and ascetics. These people are not given to arrogance, and when they listen to what has been sent down to the messenger, you will see their eyes overflowing with tears, because they recognize the truth in it. They say, O Lord, we believe, so count us among the witnesses. Why should we not believe in God and in the truth that has come down to us when we long for our Lord to include us in the company of the righteous? For saying this, God has rewarded them with gardens graced with flowing streams, and there they will stay. That is the reward of those who do good. So now let's just talk a little bit about the medicine of the prophet in Islam. In chapter 50, verse 16, the Quran says, we created man, we know what his soul whispers to him. We are closer to him than his jugular vein. This is the beginning of health, real health, and well-being. This verse expresses the idea that God is close, closer than even life itself, since the jugular vein represented life. God must come first before everything else. Then, and only then, will true mental health follow. The best way for a person to experience good mental health is by developing a close connection with God and experiencing God's love, mercy, and practical help that he can provide as they submit, love, and serve him. We cannot ignore this as therapists responsible for caring for the people experiencing emotional illness and deep inner pain. How can we ignore this? Is it ethical to bring up religion or spirituality as part of secular practice? Is it ethical? The answer is yes to both questions. I would argue that it is unethical to ignore this great potential source of healing based on what we know now from systematic research, including randomized controlled trials. I'm going to briefly review some of that now. This review of the research encompasses a period from 1887 through 2019. The sources for this research come from the Handbook of Religion and Health, Health and Well-Being in Islamic Societies, Islam and Mental Health, Beliefs, Research, and Applications, and Religion and Mental Health Research and Clinical Applications. So those are the sources for the research I'm going to discuss. Depression, the most common emotional disorder in the world. Religious people experience less depression and faster recovery from depression, and over 60% of the studies now, 6% show that religious people recover more slowly or are more depressed. In a recent systematic review of prospective studies looking at religion, spirituality, and depression, nearly 50% found that religious involvement predicts a more quicker recovery from depression or a lower incidence of depression. In other words, developing depression over time. That was published in the Journal of Affective Disorders in 2019. If you're following the slides, this is a JAMA Psychiatry article titled Neuroanatomical Correlates of Religiosity and Spirituality. So this is published in one of the top psychiatry journals in the world, if not the top. If you look at the slide, you can see that among those at high risk for depression, because parents had depression, among those individuals, if you look at their structural MRI scans, that these individuals who say that religion is very important in their life have much less cortical thinning than do those who indicate that religion is not very important in their life. Suicide. 75% of studies show that religious people just don't commit suicide as often as those who don't have a faith tradition. Here's a study out of the Harvard School of Public Health, and it shows that this was among women. This was nearly 90,000 women who were prospectively followed for a period of 14 years. They found that the rate of suicide among women who attended religious services at least once a week was actually 84% lower than the rate of suicide among those women who never attended religious services. Alcohol use, abuse, and dependence, virtually all of the studies show that religious people just don't use as much alcohol or use it in a addictive way. The same applies to drug use. Again, 84% of studies show that religious people are less likely to use drugs, illicit drugs, and even in randomized controlled trials and experimental studies, virtually all report that religious interventions reduce drug use. Well-being and happiness. So not only is religious involvement related to less mental disease, it's also related to greater well-being and greater happiness and satisfaction with life. There have been over 300 studies, and of those, 80% show that religious people are simply happier. They're more fulfilled in their life. Religious involvement even predicts mortality. I mean, not only is it good for your mental health, it's good for your physical health as well. So this is another study out of the Harvard School of Public Health, the leading public health, institution in the world. Again, nearly 75,000 women prospectively followed for a period of 16 years. This was published in JAMA Internal Medicine, shows that those who are attending religious services once a week or more are about a third less likely to die during the follow-up period. That's true not only for all-cause mortality, but also for cardiovascular mortality in particular. And it also applies to cancer. So in this next slide, you can see that there are a lot of studies showing that religious involvement is related to better mental and better physical health. So given that, these are studies published in our peer-reviewed scientific psychiatry, psychology journals. Given that, how can we ignore this potential healing influence? I mean, is it ethical to ignore it? So conclusions from the research is that religious involvement is related to better mental health, greater well-being, better social relationships, healthier behaviors, and all of these aspects improve in a person's life over time if they are religiously involved. The big concern is that as religion becomes less important in Western countries as a result of secularization, we're seeing crime rates, alcohol and drug use, and addiction rates all increasing. Religious involvement is related to better physical health as well. Less functional disability, greater longevity, and less cognitive decline with aging. Those are some of the physical health benefits of religious involvement. These findings have huge implications for public health and healthcare costs as religion becomes less common with each younger generation, at least in Western societies. Clinical applications are enormous in terms of provision of mental health care services. So here are the guidelines for the major psychiatric associations on this next slide. APA, Royal College of Psychiatrists, World Psychiatric Association. Each one of these guidelines promote or endorse that a spiritual history should be taken on every psychiatric patient. So, if not only does the data show that it's relevant, but the psychiatric associations are saying that we should be doing this. So why are we not doing it? Okay. So, what are some clinical applications? The biggest one has to do with taking the spiritual history. The spiritual history engages the person about any religious or spiritual beliefs that they have, the importance of those beliefs in their life, and how they're related to what kinds of treatment they would prefer. Sometimes religious beliefs conflict with either psychotherapy or medication use, and so this all has to be explored, as well as the role that religion plays in coping with the symptoms of mental illness. So mental health professionals have an opportunity to really support and boost the religious practices of the person by saying, by letting them know that these practices are ordinarily healthy for a person's mental health, as we've been talking about. At a minimum, though, all mental health professionals should respect patients' religious or spiritual beliefs or lack thereof. The second kind of application, well, actually it's the third. The first is taking the spiritual history. The second is respecting the person's religious or spiritual beliefs or lack thereof. And the third is actually using religion in therapy to help treat emotional conditions. So there has been a comprehensive review of the research on integrating spirituality into clinical practice. And the slide here shows you where that review is. This review looks at effect sizes across the board for randomized controlled trials that have looked at the effectiveness of religious-based psychotherapies. Examples of those that my research group has been involved in is Religiously Integrated Cognitive Behavioral Therapy, CBT, for depression. We have Muslim therapist and patient workbooks from both the Shia and Sunni tradition available on our website for free download. We are now working on religiously, spiritually integrated cognitive processing therapy, CPT, cognitive processing therapy, for moral injury in the setting of severe trauma. And we also have developed Muslim therapist and patient workbooks for that treatment. They're still currently in development, though. We've got a randomized controlled trial that are actually testing these interventions going on now at the Los Angeles Veterans Administration Hospital. Further resources, I believe my time is just about up. We have a free monthly e-newsletter that I would encourage you to sign up for. It's free. I spend a couple of days every month reviewing all of the research, summarizing it, commenting on it, and there are lots of resources that this e-newsletter includes. So it's free. Sign up for it. There's our website to do so. There are 2 books that I've written on Islam and mental health. One is Health and Well-Being in Islamic Societies. That's probably the best one. That was co-authored with Saad Al-Shohaib, who is a kidney specialist at King Abdulaziz University. The second one is Islam and Mental Health, Beliefs, Research, and Applications. So that's also co-authored by Dr. Al-Shohaib. Now, we also do a workshop, 5-day workshop, of which Rania Awad is a graduate of. She is perhaps my best student of all time. But in any case, we do this 5-day research workshop. If you can't attend the workshop, I've got a book that's called Spirituality and Health Research that's available that basically summarizes the content of the workshop. But it's great to be here on site at Duke and interact with me and my colleagues. This year it's August 10th through the 14th, 2020, 5-day intensive workshop. And we've got faculty from Duke, Yale, Emory, and elsewhere come to give the talks. I do about 90% of the lectures, but it covers virtually everything related to religion and health, and particularly mental health. We have partial scholarships available, as well as full scholarships for people from underdeveloped countries around the world. So if you have colleagues, particularly academic researchers from various countries in Africa or the Middle East or South America or Northern Eastern Europe or China or any of these areas, have them send me an email and I'll send them the application materials. It covers everything: travel, tuition, housing. It's an amazing scholarship, really. It's from the John Templeton Foundation. So here's our website. I encourage you to go to it. It's got lots of information about spirituality, religion, and mental and physical health. So that is just about it. So thank you for your attention. I look forward to answering, maybe interacting with some of you by Zoom to come. Thank you.